Okay, let's unpack this. Imagine a health system where, the goal isn't just waiting for you to get sick and then fixing you, but actively, like engineering health and wellness into your life, right from the ground up.
Yeah, moving beyond just treating symptoms to really understanding your body.
Exactly. It's a fundamental shift in perspective, isn't it?
Totally.
Okay.
From reaction to proactive design.
Hmm.
And that idea is really, well, it's at the heart of what we're exploring today.
Right. We're taking a deep dive into the vision behind something called the Health Engineering Group, or HEG.
And our guide, our map for this, is an executive summary from HEG itself. It lays out their, well, pretty ambitious goals and how they think they can get there.
So our mission here is to try to cut through all the detail and really get to the core of this proposed new healthcare system.
Figure out how it started, who it's for.
And maybe the most interesting part, this huge kind of diverse network of ideas and initiatives they want to bring together.
It's like looking at a blueprint for a very different kind of health system than most people are used to.
So where did this ambitious vision even start? The source says it goes back to one person, John Franklin Fletcher.
And his background is interesting: financial engineering, Wall Street.
Yeah, that jump from finance systems to health systems, it's quite a leap.
Definitely. The document says that the initial spark was a specific client need, developing a preventative executive compensation health delivery policy for Wall Street firms.
Okay, so like a high-end health plan focused on prevention, almost like managing financial risk, but for health.
Pretty much. And that project is where the name came from, Health Engineering Group, kind of mirroring a financial engineering group.
Makes sense, but it didn't stay small.
No, apparently Fletcher saw much bigger potential, aiming to pioneer a new global healthcare system.
Wow.
And the source uses this phrase: a true, compassionate healthcare and wellness system.
True compassionate. That really stands out. It suggests, a human focus alongside the engineering part.
And key to making this happen, they say HE's role is as a global health systems integrator.
An integrator, so connecting the dots.
Exactly. They stress that deployment depends on creating strategic alliances and bringing non-correlated groups into a cohesive new healthcare system.
So pulling together groups that maybe don't normally work together. Medicine, wellness, finance, tech.
That seems to be the idea: building bridges.
And underneath all this structure, there's a core scientific idea, right?
Yes, the source presents this premise: the basis for all known disease is chronic inflammation at the cellular, even subcellular level.
Okay, that's a strong claim. Inflammation is definitely linked to a lot of diseases, but all known disease.
It's a specific viewpoint, for sure, and their whole approach is built on it. They aim to pinpoint exactly which factors are triggering and driving inflammation.
Find the specific triggers for each person.
Right, and then introduce effective interventions to reverse the underlying cause.
So not just masking symptoms of, say, heart disease, but finding that root inflammation and actually reversing it, moving towards balanced health and wellness.
That's the stated goal. And they're very clear it's a team effort. The source explicitly says the patient is the most important person on the team.
Which is good to hear, putting the individual at the center.
Definitely.
Now, going back to that integration idea, that really does seem to be the main engine here.
It's central. They talk about bridging the gap between science and medicine, specifically by getting the best available science into their platforms.
And doing it faster than usual, right? Not waiting years for research to trickle down.
Yeah, significantly faster seems to be the goal.
And when you look at who they want to integrate and serve, the list is huge.
It really is. The source lists everything from healthcare professionals, fitness centers, spas, gyms, martial arts studios.
All the way to corporate health programs, consumer health, wellness companies, employers, multinationals, governments.
Associations, pro sports teams, even like high-profile entertainers.
And insurance companies, both life insurance and self-insured ones.
Wow. It feels like they want to weave this system into almost every part of society where health plays a role.
Okay, so how does it all fit together? They have this age schematic.
Right. That's their blueprint for what they call the next era in healthcare.
Yeah.
Aiming to really improve global health outcomes.
And they designed it using backcasting. What's that exactly?
It's like you imagine the perfect future health system first.
Okay.
And then you work backward to figure out everything you need to build and integrate to actually get there.
Starting with the end goal. Got it.
And they state this whole design is fully based on science and driven by innovative performance tracking. So data is key again.
Integration and data. Seems to be the mantra.
Pretty much.
So let's dig into some of the actual components in this schematic, because this is where you really see the breadth.
Absolutely. First, they list their own internal HEG group components, things like a natural pharmacy, telemedicine, research, consulting.
Medical tourism, even hospitals. So building some core infrastructure themselves.
Yeah. Right? The foundational stuff. But then it expands a lot.
Okay.
One of the most, well, eye-catching concepts is the global eco-spirit villages.
Eco-spirit villages, what are those?
They sound like entire communities built around wellness, not just clinics.
Huh.
The source mentions institutes for longevity, performance, even financial engineering within these villages, plus tons of activity parks, wave pools, equestrian centers, climbing walls.
Wow. So it's not just healthcare, it's embedding wellness into a whole lifestyle and environment.
That's how it reads, yeah. Living wellness, not just visiting a doctor.
Okay, what else?
Then there's a doctor support platform. This seems geared towards helping existing healthcare organizations.
Ah, so not just replacing things, but maybe upgrading them.
Looks like it. Giving them tools like telehealth, at-home lab testing, tech-based pharmacy solutions, helping them integrate some of these newer approaches.
And they're also looking at research.
Definitely.
Right.
They highlight decentralized clinical trials, calling it the future is now.
Decentralized, meaning not just in big hospitals.
Exactly. Using tech like telehealth, remote monitoring, wearables, AI, bringing the trial to the patient in a way.
Interesting.
And they specifically mentioned using this for things like cell and gene therapy, CGT, and tackling what they call death sentence diseases.
So pushing into really advanced, cutting-edge areas.
Seems so. And underpinning all of this, their whole view of the body is systems biology.
Okay, systems biology.
They call it your body, your system. They connect it to engineering systems theory, even calling it a 23rd century research paradigm.
So thinking like an engineer about the body's interconnected systems, not just isolated parts.
Precisely. Understanding the body as this complex, integrated whole, that's the foundation for precision medicine, modeling complex diseases.
All aiming for, what was it, truth, freedom, health?
Yeah, that's the phrase they use. Linking deep understanding to health outcomes.
Okay, so those are some big structural pieces. But the source also lists a ton of specific approaches and focus areas.
Oh yeah, a real mix. For example, the Peace Education Program.
Peace education, how does that fit?
It seems to add that mental and emotional wellness piece, focusing on inner strength, personal peace, recognizing health isn't just physical.
Right, the mind-body connection. Makes sense. What else?
There's Health Catalyst, which sounds like using AI data analytics to help providers improve quality and manage health across populations.
More data and tech enablement.
Yep. Then concepts like the body code system, described as a holistic way to deal with physical and emotional issues across 6 areas: energy, pathogen, circuit, misalignment, toxin, and nutrition lifestyle.
That sounds pretty comprehensive and holistic.
It does. And linking food to health, there's Eat to Beat Disease.
I think I've heard of that concept.
Yeah, it focuses on using diet to activate the body's own defenses. They list 5: angiogenesis, regeneration, like stem cells, microbiome, DNA protection, and immunity.
Using food as medicine, essentially, to boost your built-in defenses.
That's the idea. And there's a big focus on longevity and aging and essential longevity.
Right, the anti-aging health span focus.
Exploring if aging is a disease, measuring biological versus chronological age, the role of supplements, that whole area.
Which naturally leads to testing and tracking, I guess.
Exactly. Biomarker testing and tracking, using lab tests, DNA, gut microbiome analysis, all to assess risk, track biological age, and guide the interventions.
So measure, intervene, measure again. Very data-driven.
Seems to be. And then, well, then there's the list of innovative therapies and healing technologies. And this list is diverse.
Uh-oh. How diverse are we talking?
Well, it includes more standard things like rehab and clinical therapies, but also breath work, heart and air techniques, digital remedies,
Okay.
and then things like PEMF, which is pulse electromagnetic fields, bioenergetic vibration, light, laser sound, frequencies, voltage therapies.
Wow. Okay, that's a broad spectrum.
Heat, cold, water therapy, too. It really runs the gamut.
Yeah, no kidding. Anything else in the tech therapy space?
Well, connected to that is on-site decentralized diagnostics. And here they specifically mention including energy medicine and quantum energy technologies.
Quantum energy technologies. Okay, now we're definitely pushing some boundaries of conventional medicine.
Yeah, that signals a real willingness to explore concepts well outside the mainstream Western model, which, could be seen as exciting by some and maybe raises questions for others.
For sure. And finally, they list some existing clinics.
Right. Examples of innovative clinics. Places like Soul Longevity Clinic, the Cochrane Method, Forward, Swiss Mountain Clinic, they hold these up as examples that kind of align with their integrated longevity or tech-focused vision.
Got it. Sort of like real-world proof points or inspirations.
Something like that. So when you pull all these threads together,
Hmm.
the financial engineering start, the inflammation focus, the massive integration plan, eco-villages, advanced research, systems biology, this incredibly wide range of therapies from conventional to pretty far out there.
Yeah. What's the big picture? What are they actually trying to do with all this?
It really looks like an attempt at a total paradigm shift in health.
Moving everything upstream, right. Focusing hard on prevention, optimizing wellness.
And tackling what they see as the root cause, that chronic inflammation, through this giant interconnected web of services, tech, places, and philosophies.
So for you, the listener, the so what is really, what would it actually feel like to engage with a health system like this?
Exactly. How different is that from, the typical experience?
Yeah.
Which is often reactive, maybe fragmented.
This sounds much more like proactive engagement, using your own data, seeing your body as this whole integrated system, and maybe even living within an environment designed for health.
It's a very different picture.
Absolutely. This deep dive into the HEG summary, wow, it's revealed an incredibly expansive vision, stretching from Wall Street all the way to global wellness villages and exploring, well, the far edges of therapies?
It certainly has. And considering the sheer number and, frankly, the diversity of all these pieces, HEG wants to integrate, finance concepts, eco-villages, systems biology, AI trials, quantum energy stuff.
Yeah.
It really makes you wonder.
Yeah.
So a final thought for you to chew on. What do you think is the single biggest challenge in trying to actually stitch together such a vast, varied tapestry for health? Or looking at the flip side, what's the most exciting potential win if they could actually pull off this level of interconnectedness for our future wellness?
That is definitely something to think about. A massive challenge or a massive opportunity. Or maybe both.